Honorable Bill Clinton and Chelsea, leaders of our country present here, representatives of the Clinton Health Access Initiative and the Clinton Global Initiative, and all those partners here present and associated with all these efforts. World Food Program representative, ambassadors, distinguished ladies and gentlemen. It is my pleasure to welcome you again to Rwanda, Mr. President, Chelsea, and members of your delegation. I also want to assure you that here in Rwanda, you are always among family and friends. The Rwandan people appreciate your support and partnership in various initiatives that have contributed to their well-being and the development of our country. These include care and treatment for people living with HIV/AIDS, upgrading our laboratory systems, health financing, the program to improve our medical education and health management. Today, we are delighted to start a new partnership to combat chronic malnutrition. In Rwanda, we have made significant progress in achieving food security. What we have to focus on is to ensure that there is also nutrition security. We are convinced that combating malnutrition effectively should be part and parcel of poverty reduction and economic development. In any case, at this point in time, malnutrition is unacceptable in Rwanda and indeed anywhere else in the world. This partnership, therefore, comes at an opportune moment when we are launching our second economic development and poverty reduction strategy. The plan to manufacture fortified baby foods will ensure that infants and pregnant and lactating women in Rwanda have access to healthy, nutritious food all year round. Furthermore, it will serve as an engine for economic development because it will use locally produced foods such as maize, soy, beans, and milk, all purchased from smallholder farmers, thereby increasing their incomes and improving their livelihoods. There is no doubt that it will also lead to improved agricultural productivity through low-cost financing, the purchase of seeds and fertilizers, and through modern harvesting, sorting, and storage techniques. Mr. President, distinguished ladies and gentlemen, I'm pleased to say that this initiative comes as a complement to ongoing national programs such as Girinka, whereby government and individual citizens have donated around 170,000 cows to poor families. The government has also put in place a program to provide free milk to 80,000 school children in the poorest areas of our country. In addition, households have been encouraged to set up kitchen gardens for vegetables with a view to improving their dietary needs. In all this, Mr. President, we are keenly aware that to achieve nutritional security requires coordinated action by different partners: government, philanthropists, multilateral agencies, the private sector, and civil society. This particular initiative illustrates the kind of partnership that will have greater impact, and this is the way for the future. We should also emphasize here that the factory that will be producing the fortified, nutritious food will benefit many more people in our region, leading to the elimination of hunger and malnutrition and improving livelihoods. The government of Rwanda is fully committed to this project, and we wish to assure you, Honorable Clinton, and our other partner, the World Food Program, that we will do everything possible to ensure that this becomes a success. Rwandans certainly stand to gain most from it, and as pioneers, the success of this initiative will spur the growth of similar ventures in other countries with the same nutritional needs and interests. Once again, I wish to thank you and the whole team that works with you, President, and the different partners that contribute in many other ways, and our fellow citizens who have embraced all these efforts. Thank you very much.
I would like to thank Valerie Guanari, I'm sorry, I'm hoarse today, and the World Food Program for their support of this, without which this project we're about to announce would not take place. Madam Minister of Agriculture, thank you for the work and support you have given. Madam Minister of Health, you know, if you come to Rwanda and you're introducing government officials, it's the only place in the world where there's a better than 50% chance you have to say madam before you do the introduction. A great tribute to you. I would like to thank the members of the CHI staff who are here, Anna Rita Bands and all the people in Rwanda, and particularly the leader of CHI, Ira Magaziner, who has been passionate about this nutrition effort for a very long time. I am very honored to be here with my daughter Chelsea and a large delegation of people from the United States and Canada on our mission. This year, Mr. President, we were talking today, marks almost 11 years since we started working together. In that time, I have watched Rwanda achieve the highest rates of aid care and treatment coverage in all of Africa. Rates, I hasten to say, that are higher than those that exist in the United States today. I have watched Rwanda reduce rates of maternal and infant mortality and increasing the proportion of babies delivered in hospitals from just over 20% now to more than 70% in just the last few years. I am profoundly honored that we were invited by the Minister of Health and the President to engage in a massive health education and training effort to help Rwanda develop a first-class quality affordable health care system that can be run when you meet your goal to be free of foreign assistance by 2020. And there's a very large number of people, many of them in white coats to identify themselves, who are part of representatives from 10 medical schools, 6 schools of nursing, and 3 other people involved in health, 3 other institutions involved in healthcare management and administration, to do something that, as far as I know, has never been done in the annals of American foreign assistance, which is to train and empower a workforce here with the lowest administrative overhead, at least in my lifetime, only 7%. It shows the incredible commitment of the institutions represented by these fine people, and I thank them. Next year there'll be 125 of them devoting a full year, and I thank those of you who have been in the vanguard of this endeavor. Some of you I met earlier today, but this is a breathtaking effort that is deeply moving on a human level and very significant institutionally. So I thank you for that. Now, as to the project we are here to talk about, chronic malnutrition is the greatest single predictor of death in children under 5 all across the world. Most of the casualty rate is concentrated in Africa and India, but it extends to developing countries in Southeast Asia, into remote areas of Latin America, and elsewhere. In India and most sub-Saharan countries, more than 40% of the children under 5 suffer from chronic malnutrition. A few years ago, Mr. President, you may remember that you had an acute problem because of a bad farm year, and I was honored when you asked Chai to help relieve that, and I think thousands and thousands of lives were saved. But dealing with the chronic problem is very important. In Rwanda today, the rates of stunted children are at about 19% from ages 6 to 8 months, but they rise to a stunning 55% just before the children turn 2 years of age, indicating that there is a huge gap in the quality and quantity of important foods available during this critical time window in a child's life. The government has declared that large-scale action to improve nutrition is urgently needed, and that reducing chronic malnutrition rates for children under 5 from the current level of 44% is a prerequisite for Rwanda's continued economic development and its policy of making that development fully inclusive. So, we are here to try to do something about it. If this succeeds, it will once again mark Rwanda as a world leader in doing something that needs to be done everywhere. It is very important that we support the World Food Program in promoting breastfeeding from 0 to 6 months and continued breastfeeding with food supplements through 24 months. We need action to avoid another generation of infants suffering from chronic malnutrition, and we hope, and I think it's important not to overpromise here, no one fully understands all the elements that contribute to these high rates of stunting and limited growth in many countries. But it's impossible for me, as a layperson who spends a lot of time on these issues, to believe that if we attack chronic malnutrition, we won't also succeed in reducing the stunning rates. Chai and the Rwanda government will implement an innovative program to provide affordable financing for farmers through cooperatives to use better seed and fertilizer, and to provide advance payments for production throughout the year. The partnership with the government of Rwanda and the World Food Program will meet the UN Secretary General's Zero Hunger Challenge and the UN Scaling Up Nutrition. It will also provide an enormous source of income for farmers in Rwanda and an enormous new source of food for low-income families and for the children that need it most. Rwanda has created an amazingly effective community health worker system that has 43,000 community health workers. And I have been to some of the more remote areas of the country and watched these people work miracles to make children feel important, to save lives, to build communities. You have the means to distribute nutritional food as well as to produce it. And I am looking forward to doing this. We are only going to begin in Rwanda, and as we discussed in our private meetings, or in Ethiopia for reasons I take it that are obvious given the history of famine in the Horn of Africa and the level of poverty among children there. Whenever we get involved in a new initiative, I always try not to overpromise. This is a complicated issue that has never been successfully unraveled. But as I said, I have an enormous amount of confidence, first because it's Rwanda, and I haven't seen you fail at anything yet. And second, because I know if what we start out to do isn't working, you, Mr. President, and your government will be willing to keep trying something else until we find something that does work. But the bottom line is, too many kids don't have the nutrition in their bodies to grow up to be as strong or as smart as they otherwise would be. We got into this work because of our role in providing the contracts that give about 3/4 of the young children in the world their AIDS medicine. And you learn very quickly dealing with children that are HIV positive that they can't take the medicine if they don't have nutritional supplements that make their bodies strong enough so that the medicine will remain in their bodies, course through their veins, and do its work. Then we came to understand that this was a far more widespread problem that needed a far more sweeping solution. So we look forward to being your partner, Mr. President. We thank the World Food Program for making the economics of this possible, for trying a totally new model to attack this. And we hope that there will be a lot more smiling, healthy, young faces in Rwanda to help to create your next chapter of success. Thank you very much.